always good to be surrounded by people who you are in common thinking and who you know their names as we are going to delve further into our discussion and to our summit today. I am so happy to see so many people here today. Give yourselves a hand if you don't mind. So greetings and welcome to the 2017 Black Mental Health Alliance Summit. My name is Jonathan Shepard. I am the president of the board of directors for the Black Mental Health Alliance, also chief medical officer for Hope Health Systems, which is located here in Baltimore. And it is my privilege to welcome you to today's summit. I am privileged to work with such distinguished board members. Two of them are here today. I would like for them to stand. Dr. Lakita Carter, who serves as the vice president, and Dr. Nell Prim. So on behalf of the board, we bring greetings to you today. I want you to take a minute to read the letters that were penned in your book to make sure that you know that we are definitely, oh, they have not arrived. All right. Well, when they do arrive, I'm looking at my letter now. Maybe I should read my letter, but no, I'm not going to do that. I just want to say thank you to all of the sponsors who have given on today, board members, various organizations, medical institutions. We thank you for being a sponsor to this great event today, and we could not have done this without you, so I just wanted to personally say that today. I also want to thank all of the distinguished panel members, keynote speakers that will be going forth today in expounding upon our discussion topics. Thank you for your time and your energy and your resources. We're going to have a wonderful time today. And at the conclusion of my remarks, there is a proverb that has actually become one of my favorite proverbs. It states that the spirit of a man will sustain his or her infirmity, but a wounded spirit who can bear? That's Proverbs 18 and 14. And so with many residents of our communities, our children in particular, loved ones, family members, and neighbors, they have encountered travesties due to racism, resulting in emotional wounds and scars. And today's summit will contribute to the healing process and uplifting of the human spirit to overcome the challenges that we face on a consistent basis. So today we thank you for accepting the call. We thank you for partnering with us. We're going to have some others who are going to come and give opening remarks. I will have you just to be attentive to them. Mr. William Kellibrew and Ms. Lynn Mumma is going to come and also offer official greetings. Thank you.
Lynn Mumma with Behavioral Health System Baltimore. I come representing our organization, welcoming you all. We're really happy to be here. Behavioral Health System Baltimore is the local behavioral health authority for Baltimore City. This means that we partner with the state and with the city to oversee, manage, plan, and improve the quality of the public behavioral health system here in the city. We have a vision of a city where people live and thrive in communities that promote and support behavioral health and wellness. And we recognize that one of the primary barriers to seeing this vision come to fruition is racism. And we're grateful, we count ourselves very fortunate to have partners such as the Black Mental Health Alliance and others of you in the room who work with us, who partner with us, who hold us accountable for incorporating a racial justice lens, into the work that we do. And so we're happy to be here. There's 4 or 5 of us here today who are looking forward to listening, learning, and hopefully contributing. And we commit to taking back what we hear and learn here today. So thank you.
Thank you very much, Lynn, and to the board and leadership of Jan Despers, the leadership of Black Mental Health Alliance, and to the sponsors. Thank you for this opportunity to be here today. I actually like to come around a little bit. I only have 2 or 3 minutes, but I just like the connection to the audience, not be on the podium for a second. And I want to start us off today a little bit because I actually am here to speak on behalf of Dr. Wynn, our health commissioner from the Baltimore City Health Department. I am one of the directors for the Office of Youth Violence Prevention at the Baltimore City Health Department. And I have about 3 minutes, but I wanted to take some time to get us started and get us energized for today, okay? So I want to do a minute and 10-second conditioning exercise. Now, some of you all may have done this before, but I want to do it again. And if you've done this before, play along with me, okay? So it requires us to stand up quickly, if you don't mind. If you don't want to stand up, I'm trauma-informed, just go ahead and sit down. All right? So I'm going to give you a word. We're going to say that word out loud 3 times. And when we're finished, I'm going to ask you a question, and you're going to say the first thing that comes to your mind, okay? So I'm going to give you a word. We're going to say that word out loud 10 times together. When we're finished, I'm going to ask you a question. I want you to tell me the first thing that comes to your mind. Some of you have done this before, so allow us to have some fun, okay? So the first word is spot. Like on the leopard, say spot 1 time out loud. Spot. Spot. Louder than that. Black Mental Health Alliance. Spot. Spot. All right, let's go. 10. Let's keep it energized. Let's go. 1. Spot. 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 Come on. Spot. 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 What do you do when you come to a green light? Spot. What do you do when it comes to green light? Spot. What do you do when it comes to green light? What do you do when you come to a green light? How many of you all drove here today? Avoid these people here. Last word, white, okay? All right, listen, if you played this before, play along. It's fun when people don't get it and get it, all right? So, white, you ready 10 times? White, 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 come on. White, white, white. What do cows drink? What do cows drink? What do cows drink? What do cows drink? In the state of Maryland, what do cows drink? In the United States of America, what do cows drink? Have a seat, please. Thank you. Listen, I thought it was important to start off today's conversation with a conditioning exercise. When we talk about trauma, when we talk about racism, when we talk about violence, it's a pattern. It is a cycle. And if we got caught in just a minute and 10 seconds stopping at a green light and feeding cows their own milk, what do we think about the individuals, the families, the communities who experience violence and trauma each and every day of their lives, going down that pathway toward substance use? Going down that pathway toward triggers and being triggered and not understanding and comprehending their experience around trauma. And so I'm excited today to be able to support this particular event and bringing racism and trauma to the forefront of our discussion in this city. And I really appreciate that opportunity. I want to say about trauma is dehumanizing. It's dehumanizing. And so these kinds of talks brings humanity back into the space where it's often out. As well, trauma disrupts a sense of connection, control, and meaning. And so we have to bring meaning back to the discussion. We have to bring connection back, and that is the way we heal. And I'll lastly say that my own personal story of watching my family get executed when I was 10 years old in the state of Maryland was devastating for our family. And so how do you begin to think about and move forward with those kinds of events that happen in our family? It can take a lifetime. Recovery is a lifelong experience, a lifelong time of focusing on how do we address the effects of violence and trauma. And so I'm so glad to be here once again to be able to support the event and speak on behalf of Dr. Wynn and the Baltimore City Health Department. I'm going to send a paper around so you can put your email address on if you'd like to hear more about what we're doing at the health department on a daily basis, and also provide the Baltimore Crises Response hotline. It's for crises information and referral. And so I want you to take this number down. It is 410-433-5655. 5175. And again, I'll be around for the rest of the day because I want to sit and also be able to enjoy the conversation and hear what's going to be happening here. And think about the action steps you'll take away from here today. And so thank you very much again. And my kudos to Black Mental Health Alliance. I'm so glad to be here. Thank you very much.
As he was talking, I was sitting there trying to figure out how can I get everyone to now go to the website and become a member of Black Mental Health Alliance by saying it over and over and over and over again. That was awesome. I came to you to introduce our Executive Director of the Black Mental Health Alliance. I wanted to do this because this person has worked untirelessly, is a dynamic person, one who we really need to owe a lot of gratitude and debt to today. And I wanted just to take just a couple seconds just to say thank you to Jan Desper-Peters, who is the Executive Director of the Black Mental Health Alliance. This is her second go-around, I'll just say, and things get better the second go-around. And so she has definitely been on the forefront. We've worked well together. And I know it's going to be a little bit odd to do this, but I think she is worthy of this today. I want you to stand to your feet, and I want you to appreciate Jan Desper-Peters for the work that she does as the Executive Director of Black Mental Health Alliance. She did not ask for me to do that, but I just wanted to do that right now before we go further. Please come, Jan, and we thank you for all of your hard work.
Good morning. And I have to keep a promise. I promised God that if he let us come to this day, I would give him the glory. So I give him the glory for those accolades today, and I thank you for them very much. I appreciate them, but I don't do this work because of them. Hey, Black child, do you know who you are, who you really are? Do you know you can be what you want to be if you try to be what you can be? Hey, Black child, do you know where you are, where you're really going? Do you know you can learn what you want to learn if you try to learn what you can learn? Hey, Black child, do you know you are strong? I mean really strong. Do you know you can do what you want to do if you try to do what you can do? Hey, Black child, be what you can be, learn what you must learn, do what you can do, and tomorrow your nation will be what you want it to be. Now, I wish I could take credit for that, but that was written by Mr. County Cullen, and I thought it was a great way to start out this morning. Kasserian Ngara, so I'm going to follow Mr. William Kellibrew's lead and ask you to say that with me. Kasserian Ngara. So if you read the literature, and one lady I met recently at another event told me, she said, I'm coming to your conference, when she looked at my name badge. And I said, you are? And she said, yeah, as I get 12 emails a day about it, I can't help but come. So you've got to see what Kasserian Ngara is. Who can tell me what it is? Just yell it out. How are the children? How are the children? So when we were thinking about themes for this conference, we were introduced to this concept, this saying, these people, the Maasai people, some of the most fabled tribes of Africa. And it was perhaps surprising for us to learn the traditional greeting that passed between the Maasai warriors, Kasserian and Ngara. It means, how are the children? It is still the traditional greeting among the Maasai, acknowledging the high value that they always place on their children's well-being. Even warriors with no children of their own would always give the traditional answer, all the children are well. Can we say that this morning, all the children are well? Is that something that we can say? Can we attest to that, all the children are well? So unfortunately, we can't say that. We can't say that all the children are well. We can say that we are working to ensure all the children are well. But let me just give you some sobering statistics, not to bring your morning down, but to kind of give you some perspective around why this topic, these issues are so important. 39%, and this is in Baltimore City, 39% of black children live in poverty compared to 11% of white children. 22% of African American young people aged 16 to 24 are neither in school, 22%, nor working compared to 10% of white youth. In March, the average daily population of the Baltimore City youth at the detention center was 58. All but 4 were African American. 1 out of 10 Maryland residents are from Baltimore City. 1 out of 3 Maryland prison inmates are from Baltimore City. These statistics are sobering. And when we look at these statistics and we think about them, we know that we've got a lot of work to be done. But I also am encouraged when I see each and every one of you out there that we can do this together. And I'm excited about that. And you should be excited about that too. This opportunity also gives me a moment to share with you more about the Black Mental Health Alliance. And I just want to thank you, I want to thank, first of all, our sponsors, because it is because of their belief in what we do at the Black Mental Health Alliance that we are able to bring this kind of forum to you. And for those of you who were asked to have scholarship, it's because of these people that you see on the screen and on these boards that we were able to do that. And so we are grateful to our sponsors. Please give them a hand. So there's some people in the room that know the history of the Black Mental Health Alliance. And not the people who know, but the people who don't know. How long do you think the Black Mental Health Alliance has been around? Yell it out. 50 years, 20 years, 30 years, 30 years. Okay. So the Black Mental Health Alliance is a nonprofit organization, which you already know, and we've been around for 30 years. And it was created by a group of health and mental health providers of color, specifically people like Dr. Maxie Collier, who was the first Black health commissioner at the Baltimore City Health Department, Dr. Janice Stevenson, and the Honorable Senator Shirley Nathan Pulliam, who will join us at some time during the day. They saw a need in their healthcare work settings to provide cultural competence and sensitivity training. And so that's why we're called the Black Mental Health Alliance for Education and Consultation. BMHA is unique and well-rounded, but we also have a history of service provision. So over the years, and even to this day, we have provided services that include things like school-based mental health services, tobacco education and prevention. We even had a summer camp. We used to run it right in this church. After-school programs, HIV and AIDS prevention initiatives, and a host of many others. About, I guess it's been 2 years ago now, the Black Mental Health Alliance convened what we called a group of community healers, really because of a conversation I had with my board president, Dr. Jonathan Shepard. And we framed our idea around this concept of Black Minds Matter. Baltimore Rising, Summoning the Village, and we had a series of forums. Those forums convened starting July 2015 and ran through June 2016. We had a series of 10 forums. I'd like to acknowledge my partners in crime, if you will, who stood by me every step of the way as we've started framing Black Minds Matter, Baltimore Rising. And that's Dr. Anel Prim and Ms. Alma Roberts. And I just want them to wave if they don't want to stand. These are my big sisters, aunties, good friends. I'm telling you, it's nothing like a good friend. A good friend that has your back and will just stand in the gap and just do whatever it is that needs to be done without asking. That's the kind of friends these are. And so I could not do this kind of work without people like them. The series was an innovative and inclusive approach to community engagement, and we brought together national and local thought leaders on a variety of topics. This seminal work toward healing acknowledged the historical trauma and stress that Black folks experience on a daily basis and explores how it affects their feelings, thinking and action. This forum series was a natural extension of our 3 decades of history, and today we will unveil, and I wish I had a drum roll, unveil thank you, oh my goodness, thank you, you have brightened my day, thank you. Today we will unveil the recommendations from the issues highlighted during that series. We had some challenges. Y'all keep praying with our printer and the print collateral. That's what they call it, print collateral. But the print collateral is coming. Can I get some believers that the print collateral is coming? Okay, the print collateral is coming. The devil is a liar. So in addition to those programs that I mentioned, the Black Mental Health Alliance also does a series of community grand rounds, and we host and help facilitate the emotional emancipation circles. We are so happy to be involved with the Community Healing Network and the Association of Black Psychologists in this effort. We also are very excited to have some of our facilitators here, Ms. Margaret Powell, who will be sitting as a moderator this afternoon, but also the work of Ms. Charlene Phipps, who was the original EEC in Baltimore, and has lent her time and talent to help us continue to expand this effort in Baltimore. Thank you, Charlene. Another good sister, another good friend. Thank you, Sister Margaret. So these EECs are in and around our city. We can give you more information about those. They're self-help and healing circles for Black folks to be in a safe space. And one of the things that really, really attracted us to them is that they really look at the essential, powerful, and culturally relevant strategies for healing from historical, race-based, and intergenerational trauma. I also would like to mention before I close that we are in a very exciting partnership with CRISP. How many people know what CRISP is? C-R-I-S-P, okay. If you're a provider and you work in a practice, you know what CRISP is. But CRISP is the Chesapeake Regional Information System for Patients. And it's an information exchange service in Maryland and DC. And most, I would say, venture to say all, of the hospitals in Maryland, DC, and most in Northern Virginia are connected, which means that they can share information about their patients, right? In the groundswell or the healthcare transformation piece where they were connecting hospitals and connecting physical health physicians, the behavioral health clinicians didn't get caught up in that groundswell. So for the most part, there are no or very few behavioral health practices that are connected to CRISP. We are trying to change that. In partnership with CRISP, we will be working, and I hope that you will sign up. Some of the CRISP folks are gonna be here. The technology partner that we're working with, Zane Network, to get you connected, they're gonna be here in the wellness suite, which I hope that you will visit, and visit our vendors. I know that I'm supposed to say that, I forgot, but visit our vendors during the breaks. And they're also, it's so important to them, and it's such a priority to them, that there is a monetary incentive to be connected to CRISP. If you are in a practice, a behavioral health practice, you need to talk to the folks here today. I'm not talking about $2 or $3. I'm not even talking about $200 or $300. I'm talking about thousands of dollars that are available. And I know that you can agree with me that a lot of times when these things happen, we don't even know about them, right? But I'm talking about between $3,000 and $10,000 initially per practice, and then up to $10,000, up to $30,000 total, depending on what disciplines you have in that practice. So please do not leave today without speaking to the folks at Zane Networks about this initiative. So I'm about to close, but I wanted you to know that I'm excited about today. I'm excited to see all of your lovely faces, and I'm hoping that you will take down notes, because one of the things that we asked each presenter was to leave you all with tools imaginary but real, that you can put in your toolkit. And when you leave here today, you won't just say, wow, that was a powerful speaker. Nana tore it up, right? But you will actually have tools to take back with you in your community, and that you can emphatically and flat-footedly say, I, Jan, can do this when I go back into my community to ensure, step by step, day by day, that all the children are well. Thank you. I'm bringing up my good friend, Miss Alma Roberts, who, now Alma knows everybody, and everybody knows Alma. You can give her a better clap than that. Thank you. So Alma is now Dr. Destiny-Simone Ramjohn's colleague, but Alma and I have known each other for a very long time, and she's now a senior manager at Kaiser Permanente. And so I've asked her to please introduce her colleague, Dr. Ramjohn, and facilitate the question and answer session.
Good morning, everybody. You know, it's a cliche to say I'm pleased to have an opportunity to introduce a speaker. But I would actually break out in song for you about how happy I am to introduce my colleague this morning. But I will save you the trauma of hearing my voice. Dr. Destiny-Simone Ramjohn is the Director of Stakeholder Relations for Kaiser Permanente, one of America's leading integrated health care providers and a nonprofit health care plan. So that gives you her title. This young woman is dynamic. She is a researcher. She is a thought leader. She is passionate about the work of equity. She is enmeshed in the communities in which Kaiser Permanente of Mid-Atlantic states serves, engaging partners in very strategic ways around the work of equity throughout our region and informing the work that Kaiser Permanente does throughout the nation. Dr. Ramjohn received her doctorate from Columbia University. But I'm going to tell you, I don't know this for sure, but I'm going to bet that her position, her passion, and her drive for equity was grounded in her education at the HBCU she attended, North Carolina A&T. And so I'm going to let her just take it away, and not a whole lot more talking. But come on up, Destiny-Simone, Dr. Destiny-Simone Ramjohn.
Imagine with me for a moment that you are standing on the edge of a beautiful river. Yes? Okay. Is that better? Okay. Did you hear the first part about imagination? I won't ask you to close your eyes, but I do want you to take a moment to imagine that you're on the edge of a beautiful river when suddenly the scene is pierced with the screams of a flailing, drowning child. Without thinking, you do as most of us would do. You dive in, you grab the child, and you swim to shore. Before you can recover, another child comes floating by, and you dive in to rescue her as well. Then another child drifts into sight, and another, and another, and another. You call for help, and people take turns fishing out child after child after child. And hopefully before too long, some wise person will ask, who keeps throwing children in the river in the first place? And then head upstream to find out. So the parable of the river is a classic for medical sociologists like me who study health and illness because it so vividly describes how social forces upstream. Yes, Jane? It doesn't move forward. Okay. So just give him some kind of indication. Okay, I'll do my Obama hand motion. So we're talking about the upstream determinants of health, okay? I think that parable really gives a vivid description of how what happens upstream impacts health downstream. And so often when we think about the upstream determinants of health, we think about things like transportation or housing status, but we're also compelled to think about these issues more historically. So here's a quote. Is that a quote?
Yeah.
Yes, thank you. Here's a quote from a little earlier in our nation's history. So take a few moments to read it. You don't have to read every line on the screen, but you can get the gist of it from the first sentence, which reads, "I am not, nor have I ever been in favor of bringing about in any way the social and political equality of the black and white races, nor have I ever been in favor of making voters or jurors of Negroes, nor qualifying them to hold office, nor to intermarry with the white people. And I will say that in addition to this, that there is a physical difference between the white and black races, which I believe will forever forbid the two races from living together on terms of social and political equality." Can anyone guess who said this? Absolutely. None other than the Republican candidate for United States Senate from Illinois, our very own Abraham Lincoln. How about this one? Again, no need to read line by line, but here you can get the gist from terms like slower track and black scientists come from lesser schools. Who said this? Absolutely. United States Supreme Court Justice Antonin Scalia during oral arguments for Fisher versus University of Texas, a case over whether the university's use of race in a sliver of its admissions decisions is constitutional. I share these two quotes because when we are thinking about the work of going upstream to impact healing and the social determinants of health, we're called to recognize that these harmful views from individuals in positions of power form a system that creates a set of unequal conditions that has life and death implications. So it's from this lens that my talk today will examine what is throwing children in the river in the first place. The United Nations believes that structural discrimination is among the most important upstream determinants of health. A 2016 report on the conditions of African Americans in the United States notes the persistent gap in almost all the human development indicators, such as life expectancy, income, wealth, level of education, and even food security among African Americans reflects the level of structural discrimination that creates de facto barriers for people of African descent to fully exercise their human rights. The current human rights crisis the current human rights crisis must be addressed as a matter of urgency. I don't have to tell you that going upstream is not easy work. Going upstream means thinking differently about the social determinants of health. So modeled after a lecture given by Professor David Williams, a Harvard School of Public Health scholar, as well as the findings of our recent community health needs assessment, I'm going to dig a bit deeper to review data for 3 social determinants of health: residential segregation, socioeconomic security, and discrimination, and then explain the ways in which each of these drive disparities in health. I need some water. One second. Sorry. Water. See some water. Thank you. Had too much coffee. I feel dehydrated a bit. Next slide. So as the old health disparities adage goes, your zip code is a better predictor of your health than your genetic code. In most of the communities Kaiser Permanente serves, there are short distances to large gaps in life expectancy. For example, a baby born in Roland Park is expected to live to the age of 84, whereas the Lexington Hill baby is likely to die at the age of 65. Thank you. That is nearly 20 years of life lost prematurely before the baby even leaves the hospital. Next slide. This slide compares life expectancy in West Baltimore to countries like Iraq and North Korea. Findings from Dr. Williams' study points us to one upstream answer to disparities in life expectancy: residential segregation. For some, like the quote from Abraham Lincoln I shared earlier, the mere mention of segregation suggests the past, a shameful historic moment that we've moved beyond. But the truth is, residential segregation still exists today. Think about your own community. Would you describe it as diverse? Would you describe it as inclusive? If you think the answer is yes, you're most likely wrong. Much of the United States remains residentially and racially segregated, with almost a third of African Americans living on blocks that are more than 90% Black, and over half of the white population living on blocks that are more than 90% white. The truth is, the most diverse cities in the US also tend to be the most segregated. Residential segregation is critical to understanding health disparities. In 171 largest cities in the United States, there is not one city where whites live in equal conditions to those of Blacks. And residential segregation has a long history right here in Baltimore. This is a cover of the New York Times from December 1910, when an ordinance was passed that stated no Negro may take up his residence in a block within the city limits of Baltimore, wherein more than half the residents are white. Recent data shows that this segregation remains largely constant in Baltimore City, even today. So what does residential segregation have to do with health? Research has examined the effects of segregation on young African American adults and found that the elimination of residential segregation would erase Black-white disparities in earnings, in high school graduation rates, in unemployment, and reduce racial differences in single motherhood by 2/3. And not only does residential segregation impact health, it impacts the second social determinant of health I want to talk to you about, socioeconomic security. This is a slide from one of Dr. Williams's more well-known lectures titled "The House That Racism Built." Racial differences in income are substantial. For every $1 whites earn, Hispanics earn 70 cents, African Americans earn 59 cents, while Asian Americans earn about $1.15. But income is only the tip of the iceberg. For every $1 of wealth whites have, Asian populations have 81 cents, Latino populations have 7 cents, and Black populations have just 6 cents. And these findings are consistent with Kaiser Permanente's own community health needs assessment. As part of federal ACA regulations, Kaiser Permanente conducts community health needs assessments to identify needs and to resources in our communities and to guide our community benefit investment strategies. In 2016, we analyzed over 1,000 indicators, conducted over 15 hours of interviews, and gathered close to 60 surveys. And our findings indicate that the #1 health need in the Mid-Atlantic states and here in Baltimore City is socioeconomic security. So for example, in Baltimore City, as Jan mentioned earlier, close to 1/4 of the population lives below 100% of the federal poverty level. That's $66 a day for a family of 4 per year. Baltimore City also has the highest percent of the population in the region without a high school diploma and the lowest high school graduation rate, despite recent improvements. But Baltimore City is not alone in the region. Among all our survey participants, from Fairfax to Prince George's County, 93% describe the health impact of income on their community as severe or very severe. And all the health department experts that we spoke with discussed income as a prominent driver of poor health outcomes in their communities. So like the national statistics, there are also significant racial ethnic disparities along these economic indicators. In our CHNA, Blacks were more likely to live below the federal poverty level when compared to whites everywhere we looked. In Baltimore City and Baltimore County, for example, Blacks were twice as likely. In Anne Arundel County and Howard County, Blacks were 3 times more likely to live in poverty when compared to whites. In Howard County, Hispanics were 4 times more likely to live below the federal poverty level. I could cite hundreds of studies devoted to the relationship between health and low socioeconomic status. Whether national or here in Baltimore, the evidence is clear. Thank you. Okay, thank you. So the third and final social determinant of health I want to talk about is discrimination. Just as segregation and socioeconomic security matters, so too does discrimination or differential treatment of members by one group, by both individuals and social institutions. Discrimination is pervasive in the most basic of American life tasks: getting a job, obtaining a bank loan, or getting health insurance. Discrimination is so common, so everyday, that scholars developed a scale for it called the Everyday Discrimination Scale. And it includes measures like you are treated with less respect than other people, you receive poorer service than other people, people act as if they think you are not smart. To be clear, experiencing discrimination is not just a minor annoyance. On the bottom of the slide, you'll see that the impacts of these daily and cumulative discriminations on health are well documented. Everyday discrimination is positively associated with coronary artery calcification, high blood pressure, low birth weight, poor sleep, and even mortality. Discrimination is literally killing communities. So the data on the 3 social determinants of health I reviewed, residential segregation, socioeconomic security, and discrimination, leave me with a burning question. Now what? So when I'm faced with these kinds of existential crises, I turn to the ultimate source of inspiration. No offense, New Shiloh, not the Bible, TED Talks. And I listened to Mary T. Bassett, Commissioner of the Health Department of New York City, say the following: our role as health professionals is not just to treat our patients, but to sound the alarm and advocate for change. Rightfully or not, our societal position gives our voices great credibility, and we shouldn't waste that. We all play a role, an important one, in transforming communities and the health of our nation. So guided by Mary T. Bassett, we must critically examine our position in society to truly live up to today's theme. To truly heal communities, we must become champions of equity, and we must be prepared to call for dramatic transformations of our programs, our policies, and our practices to address the upstream determinants of health. And that is precisely the bold approach that Kaiser Permanente has been taking for over 70 years. One second. Thank you for your patience. I'll just hold it, it's fine. Okay. So Kaiser Permanente's vision is that we are trusted partners, and I keep bending down because I can see in the mirror what side we're on. So Kaiser Permanente's vision is that we are trusted partners in total health, collaborating with communities and individuals to help them thrive, and creating communities that are among the healthiest in the nation. Generally, when people hear KP, they think we mean high quality care and the coverage that we provide. And some might even think that when KP is talking about health, we mean hospital or nurse or emergency room. And we do mean those things. But we also know that most of what determines an individual or community's ability to achieve health has more to do with what happens between the spaces of your doctor's visits. In fact, we know that for optimal health to be achieved, it requires several things to be in place, including peace, shelter, education, food, a stable ecosystem, sustainable resources, and my 2 favorites, social justice and equity. And Kaiser Permanente implements our approach to equity both horizontally and vertically. So a message from our illustrious CEO, Bernard Tyson, who recently said, many people in America have limited access to grocery stores, or they live in communities with inadequate public safety and low employment. From many of these neighborhoods, however, came our finest civil rights leaders who created movements that made lives better despite infrastructure challenges and lack of resources. Yet imagine how people could thrive if health equity was built into the social fabric of the community itself. Kaiser Permanente believes that life, liberty, and the pursuit of happiness requires total health, and that includes equal access to high-quality health care for all. And we are in growth mode. So I'll skip through this slide, except to say that we have about 11.8 million members nationally, and here in the Mid-Atlantic states, we have about 700,000 members, 50,000 of whom are Medicaid members. We also have close to 8,000 employees and 31 medical facilities across the Mid-Atlantic states. So a part of our vision and mission, total health, means that we believe that we can contribute to equity. But what is total health? So total health is using all of our assets to influence and advance equity. It means that we focus on the mind, body, and spirit of individuals just as acutely as we focus on the economic, social, and environmental conditions. So our focus on total health is a recognition that there are socioeconomic factors that determine health outcomes, and we have to leverage all of our assets to create healthier communities. So what's displayed here is how we operationalize that mission. On the left side, you'll see the County Health Rankings Framework that describes how elements like the physical environment or health behavior impacts health outcomes. On the right side are many of the functional areas of our large enterprise, and the arrows indicate the role of each of these assets in advancing a total health agenda. So for example, you'll see that the arrows emerging from procurement and supply, okay, I think we got it, third time's the charm. Thank you. Thank you. We have an amazing AV team. Thank you so much. So let's dig a little bit deeper into how this total health agenda is taking shape across the nation. As purchasers, Kaiser Permanente impacts jobs and the economy. Recent analysis of select spend categories nationwide indicated that we spent about $4 billion, which resulted in 40,000 plus jobs, generating over $2.5 billion in income and about $570 billion in federal and state taxes. This doesn't represent the full KP spend, but what if this magnitude of purchasing power was refashioned to promote systems change, to centralize economic wealth with businesses that support underserved communities? Well, we did just that. In Los Angeles, for example, we implemented the Inner City Capital Connections program for over 100 businesses, 62% of whom were minority-owned, with roughly 3.2 million in average revenue. The goal of the program is to ignite small businesses and to stabilize the economic landscape in the most vulnerable communities. So let's bring it closer to home. As a philanthropic organization, we accelerate the ecosystem. In the last 10 years, nationwide on our community benefit journey, we've created a solid foundation for total health. We invest close to $2 billion nationally each year. So these 4 items are meant simply to add to the strong toolkits that you already possess. Leaving here today, I would like you to consider these 4 elements as critical to institutions and systems change to begin healing in Baltimore. First, develop strategic partnerships. Numerous benefits can be achieved by being involved in an effective and strategic partnership, both for the individual and the institution. Second, you must measure. What doesn't get measured doesn't matter, and I don't mean tracking a single indicator over time. Third, engage. Go ahead and put a ring on it. Engaging our strategic partners in all aspects of the work is crucial. Our community needs assessment, our subsequent planning process, and the ways in which the effectiveness of the work will be measured all included community partnerships that were so critical to our success. Finally, innovate. Every one of us should consider how we can become a driver of innovation to advance health. I don't have enough time to give you an example of our social innovation challenge, but suffice it to say, we hosted a wonderful event that was a citizen social venture contest last fall that provided the development of technological and non-tech solutions to some of Baltimore City's most complex problems. I challenge you to leave here today and bring to every room that you attend to ensure that decision makers are applying an equity lens and considering health in all policies that engages community, makes systemic change the ultimate goal, and drives innovation to lead boldly with equity. Thinking back to the parable that I shared earlier, We must work to eliminate residential racial segregation, racial ethnic disparities in health, and promote reconciliation to improve health. I don't know where you are in the metaphorical river or how many bodies you have to pull out on a day-to-day basis. But I do implore you that no matter where you are, to be like this baby. Be courageous, because we don't have to have all the answers to affect change. We just need courage. The health and healing of our communities, the health and healing of us all depends on it. Thank you. They did all that work.
We can do better, Baltimore, come on. So we have time for questions, but I wanted Dr. Ramjohn to say a few words about the groundbreaking work that Kaiser Permanente has done around the adverse childhood experiences model, if you will. And so I'll lead in with that, and then I'll open it up for questions.
I just talked for 30 minutes. I really don't want to talk more about ACEs. How many of you are familiar with the Adverse Childhood Experiences study conducted by Kaiser Permanente? The short of it is that cumulative disadvantage is demonstrated to impact children across the life course, across their life course development. So things like experiencing substance abuse, experiencing physical abuse, et cetera, is not just something that impacts them as they are experiencing it during childhood, but the cumulative disadvantage is not just experienced throughout their own life course, but throughout generations as well. And I'd be happy to take questions about ACEs and how we're incorporating that cumulative disadvantage model to address the health of communities at the close of today. So I'm going to turn it over to questions.
Other questions? Anybody? Questions? Thank you, Dr.
Wait,
One back here.
good morning.
How do we involve the politicians in this? Because they are the ones who make decisions that affect our community. So how can we engage those players?
Absolutely. I think that the Legislative Black Caucus of Maryland is doing quite a bit of work to implement a health in all policies point of view. I think the first step is engaging and advocating with our legislators. It's very hard for legislators who don't live in the community or who don't spend enough time understanding the data to make sense or to put health on their agenda. I think Senator Nathan Pulliam in the 41st District has a really good example. Her Social Determinants of Health Task Force is a partnership and a collective that is bringing together not just the data, but is engaging with communities to set a platform that can then be brought into legislation. So 2 examples, including the Health in All Policies approach and Senator Nathan Pulliam's Social Determinants of Health Task Force, are ways in which I've seen that work unfold very powerfully in Baltimore. I think it starts with the data, and then it also starts with engagement. The deeper we can connect their policy agenda to the ways in which health impacts us all, making the economic case for health, for example, making a business case for health, are strategies that gets legislators up and listening, and I also think it's very actionable. 44th District, thank you. There was another question? One second for the mic, please.
We just need you to speak in the mic so we can capture it on the video.
Thank you. Now, yes, my name is Toriano Fisher from Bon Secours. I have a 2-part question. The first part is, you mentioned you were working with 2 high schools. What zip codes are these high schools in? And the second part is, what's the name of the high schools?
The first high school is Dunbar. I don't have the zip code for Dunbar or the name of the second school, but I will check my email and walk over to you after the presentation. For each of the two, 05.
Is there a point around the question about zip codes? Well, I know you're with Baltimore, so I want you to know that if we're not there now, it's just a matter of time. We'll be in 21223. Major initiatives will come.
But we do make I think it's a good question, because we do make a concerted effort to do zip code level analysis to ensure that we are addressing our investments in the most high need and pockets of vulnerability. So the two high schools are located in East Baltimore. This is a partnership with Johns Hopkins University and the University of Maryland. As Alma mentioned, we'll also be unfolding a West Baltimore initiative that is focused on 21223 in West Baltimore in partnership with organizations like Bon Secours and others that is a place-based strategy. Our approach is go local. We believe that addressing the most the areas with the most vulnerability has the highest impact on our investments. And so that is the targeted level with which we examine our work, and we're also looking for zip code and block by block analysis as well.
One more question. Yes.
Yes, my name is Renee Cohen, and I'm here from Senator Ben Cardin's office. I'd like to take a little bit of a leap because this is such a great audience for me to make this statement. And if Senator Cardin were here, he'd say the same thing. This woman next to me asked a really good question: how do we affect our legislators, our elected officials? The leap is that let's leap to Washington, D.C. right now. And we all know that the Medicaid system is really in danger. The one thing that Senator Cardin, and I'm going to be with him tomorrow talking to 2 health groups, the one thing that is making a difference, hopefully our Constitution is working, and you all know what I'm talking about, but it's we the people. And the reason right now that some things are going the way we hope they will go is because people are speaking out. Many of you are fortunate, well, we are fortunate here in Maryland. We have a reasonably decent elected official cadre of people who truly feel, as Senator Cardin does, that we must secure and protect the Affordable Care Act as much as possible. Many of you have relatives in other states. People say, what can I do? You need to reach out to your friends and relatives, particularly in states where there are Republican majorities. You need to reach out to those people and say, get on the stick, organize your community, do what a lot of people are doing across this country. You cannot sit by and just let this happen. So I thank you for giving me the opportunity to make this statement. It's a little off the what you're talking about, but it's just too good of an opportunity not to get you to think about what your responsibility is and how you can help. Thank you.
Okay, so Jan, that's it, or do we have time for one more question?
Good morning. My name is Milagros Phillips. About having legislators participate, I worked on a program that was funded by the Kellogg Foundation called Congressional Conversations on Race. And the program lasted about 3 years, where we engaged members of Congress on having a conversation on race with each other as well as with their constituents. And I think it's really important to continue those programs, because if we are not in front of their faces, they're not always thinking about us. So it's really important to have more of those conversations and have more of our legislators have those conversations with all of us. So thank you.